Hello, this is Ahmed Nsaif, Medical Instrumentation Engineer. Today we're going to go for a fast illustration for Bipap, which is most important devices as used for the airway respiratory zone, therapy zone. So, best lecturer, credits to Haneen Dhyeaa for Medical Instrumentation Engineer. Let's go. So, the Bipap in general in this animation video, it's referred to the bi-level positive airway pressure. So, this BiPAP is non-invasive a form ventilation for commonly used in the field of respiratory care. So if you want to know more, just quick overview for the BiPAP, keep watching this animation video at all. So through this respiratory therapy zone, we're gonna know more information. Let's go with this. So BiPAP, as I mentioned, is a type of non-invasive ventilatory support, which gets in the name because it provides two levels of pressure, IPAP and EPAP. So the IPAP stands for inspiratory positive airway pressure, it's an airway pressure. It's above the zero during the inspiratory phase of breathing. Hence, it works similar to the peak airway pressure in traditional mechanical ventilation. However, so if you increase the IPAP setting, it will be increase the delivered for tidal volume. EPAP, on the other hand, stands for expiratory positive airway pressure. Moreover, it's in an airway pressure that is above the zero during the expiratory phase of breathing. It's work similar to the PEEP. It's traditional mechanical ventilation, or CPAP, or PAP for during subtenuous breathing. So it's different. Increasing the EPAP setting improves the patient's oxygenation by increasing the functional of residual capacity. So essentially, you can make adjustments to the IPAP and EPAP settings depending on the patient's ventilatory and oxygenation status. However, so to recap, and the IPAP, it was a control for the tidal volume is delivered EPAP function, and as a PEEP as a support the patient oxygenation. There are two primary indications for the BiPAP: acute respiratory failure and acute extirpation of COPD. And the best way to determine if the IPAP indicates to look at the patient's ABG results. It's important. Just to give an example, this example will be illustrated. So the patient has a decrease in the pH and increase in PaCO2. We could recognize the ventilatory issues and present, and bypass will be indicated. Cardiogenic pulmonary edema. It's also another common indication for BiPAP, and it has been shown in the decrease the need for traditional mechanical ventilation in these patients. Since we are talking about the BiPAP would be indicated for now, we need mention it should be not used for other contraindications for BiPAP, and they are apnea, unmanageable secretion, facial burns or trauma, and also claustrophobia. Switching the gears, which just beat the talk about it, making the changes in the BiPAP settings depending on the patient needs. This is so important to know to make the adjustment the IPAP and EPAP pressure levels and the settings of the machine. So now a good starting point for PPAP is 10/5. Now, of course, this is just a general example. It's not always the case. So what I mean is by this is the initial IPAP setting would be 10 and the initial EPAP setting will be 5. But that operated initial pressure setting for IPAP and can be ranged from 8 to 12. The operating initial settings for EPAP range, it will be 4 to 5. Both in the IPAP and EPAP settings can be adjusted for the increment for 1 or 2 depending on the needs of the patient. For example, if the patient in the respiratory acidosis and needs for large tidal volume to try to decrease the PaCO2 value, you would want to increase the IPAP setting, or if you needed to improve the patient oxygenation, you would need for increase for FiO2. But another way to do this to increase the EPAP settings, which initially is the same thing as increasing the level of the PEEP. So there you have, and this is the BiPAP and all illustration. Thanks for watching. Everyone will get benefit of this video. Best credits to Haneen Dhyeaa. This is Al-Mansour University College Medical Instrumentation Engineer.